So the job of the thyroid is metabolism of all of your organs, meaning it tells all of your organs to get up and go in the morning. So without thyroid, if your thyroid isn't working correctly, right, then you're either your metabolism is going to be way under, and I don't just mean metabolism of food. I mean all of your organs do not get a message to get up and do their job today, which hopefully y'all know the jobs of the other organs.
Yeah.
Okay, that's good. Okay. And then if it's hyperthyroidism, then what's it doing?
It's increasing.
So it's telling all of your organs what?
To produce more.
Too much. So hypothyroid is none of your organs are getting up and going. And hyperthyroid is
too much.
They're too much. They can't ever settle down.
Yeah.
Okay, so give me some signs and symptoms of hypothyroidism.
Hypo, low and slow. So
bradycardia. Hypotension, maybe, yeah. Start at the top of your head. What happens to the brain?
Like central nervous system is.
I'm thinking like everything's slow. You're like snoozing out.
Yeah, like you have a hard time concentrating. That's probably how happy y'all feel right now. You like feel kind of foggy headed, right? You're just like, and you're always tired, right? Because everything is super slow. All right, then let's go down.
Your heart.
Bradycardia, your respiratory rate. Your gut.
Slow.
So you're constipated. What happens to your weight? Increases because you can't get up and move around. You're just so freaking exhausted. Your skin's dry. You're like, you just feel blah, blah. Okay, you with?
Yes.
Okay. Yeah, your hair can get real brittle and kind of fall out, right? So we've got to tell your thyroid to wake up so it can tell
the rest of your organs to get up and go. Okay, there's one drug for hypothyroidism, and it is called levothyroxine. Levothyroxine. All right. This is a synthetic form of T4. Okay, now you've got T3 and you've got T4, and then you have TSH. Okay, so in hypothyroidism, your T3 and your T4 are high or low? Isn't one high and one's low?
No, they both go
together. They're both low?
Mm-hmm. Yeah.
And
so since it's hypothyroid, both T3 and T4 are low, which means what does your TSH stand for?
Thyroid
stimulating hormone. So it makes sense that your TSH would increase because it's trying to stimulate
your thyroid.
Okay. T4 is a inactive form. Like it has to be converted into T3 to actually work and tell your organs to get up and go. So this levothyroxine is a synthetic form of T4. It is converted in your body to the active metabolite T3. Y'all with me?
Yes.
Okay. It has a 7-day half-life, okay, which means how many days does it last in your body?
28?
28 days, because it takes 4 half-lives for it to work its way all the way out of your body, okay? So I want somebody, one of y'all, to explain to Courtney what the half-life is. Raise your hand. You can pick amongst yourselves. Okay, we'll be here all night if somebody doesn't. Yeah, I know y'all know what it is.
The drug half-life is how much the medication, like, it works. So this one is half a life. So, like, 50%, right? 50% of the drug is at each dose. So it takes 4 times, right? Times 4?
It takes 4 half-lives. Okay, so what she's trying to say. Okay, so a half-life is how long it takes for half of the drug to make its way out of your body, okay? It takes 4 half-lives for it to completely work its way out, and it's half of what's left in your body. So, for instance, if I gave you 100 milligrams of a drug and told you the half-life was 1 hour, in 1 hour, you'd have 50 milligrams left in your body. An hour later, you'd have half of that. So 25, and then an hour later you'd have 12.5. And by that point, by 4 half-lives, it's not really working in your body because the dose is so low. So when it tells you that there's a 7-day half-life, it will stay in your body for 4 half-lives, right? So this will stay in their body for 28 days. You take however the amount of time is times 4. This drug takes 1 month to hit a steady state. Now, does anybody want to explain steady state?
Where it's a therapeutic range?
All right, so steady state is it takes you a long time to get up in there, but once you get up in there, that tells me how long it takes for you to reach where the drug will actually stay at a normal level. Because, like, for instance, if you guys take an antibiotic, right? The first time you take an antibiotic, it hasn't hit a steady state in your body. It's not working yet. Then you take the second dose. It goes a little higher, but still hasn't gone completely where it needs to be. Usually it takes 2 to 3 days of an antibiotic before it really hits the steady state. You understand? So for this drug, it takes an entire month to hit a steady state, okay? So that means that once I start them on the drug, I'm going to have them come back in.
To draw their labs.
1 month to get their labs so I can see, because they should be in a steady state by 1 month. Are y'all with me?
Yes, ma'am.
Okay. Are you sure? Cool. All right. So this is a thyroid replacement drug. It is a lifelong thyroid replacement drug that is often testable. Okay. Levothyroxine is for the rest of your life, because they don't ever want to find out what the cause of your broken thyroid is. They're just going to put you on medicine for the rest of your life. Got it? All right. Highlight, it is safe for pregnancy. They always love to ask these types of questions. Okay. And it's very important when they're pregnant to take levothyroxine if they're hypothyroid, because if mom is hypothyroid, the baby is hypothyroid. Okay. And what do hypothyroid babies look like when they're born? What do you think they look like?
Big.
They're not big or small. They're normal size.
Oh.
But what do we say the thyroid does?
The organs.
So all of their organs. So when that baby is born, they're like,
yeah,
they don't move. They barely even cry. Like,
oh.
They can't suck. They can't feed, because everything is so weak. So it's very important that if mom is pregnant, she's hypothyroid, that she takes the levothyroxine. That's probably the ugliest view I've ever seen of myself. So y'all enjoy that video later. Okay. So yeah, it was like I had like 7 friends like this. Okay. So also, if you go to the Atumba, okay, synthetic form of T4 going into active T3 is very important. Testable fact. Okay. This drug, levothyroxine, is 99% albumin bound. Somebody tell me what that means. When a drug is albumin bound.
That means that it attaches to the albumin, so then it's not effective.
What isn't effective?
The drug.
Which part of the drug?
Is it the Levothyroxine?
Yeah, because then there's...
Okay, so I'm going to explain albumin. Y'all, come on.
I'm not good at explaining.
I know these pharmacokinetics are going to haunt y'all through this whole course if y'all don't remember what these are. So an albumin bound drug, first of all, what's albumin's job?
To hold on to fluid.
It keeps fluid in the vessel. And this is very important, Courtney, for fluid and electrolytes. Albumin is a protein that lives inside your blood vessels, and its job is to
hold on.
Keep all that fluid inside the vessel. So if a drug is albumin bound, the drug that is bound to the albumin is not working. Only the free drug works. Okay. So since it's 99% albumin bound, what happens if your patient has low albumin?
It's not gonna have no albumin, so then the vessels are gonna be...
No, I'm asking about this drug.
Oh.
If the patient has low albumin and they're taking levothyroxine, they're going to go toxic because there will be more free drug that isn't attached to the albumin. What's a normal albumin level? Write this down, Courtney.
0.6 to 1.
That is BUN and creatinine.
Oh.
I mean, that was creatinine, sorry. Normal albumin.
3.5.
3.5 to 4.5. Okay. So if they say, hey, your patient's taking levothyroxine, their albumin level is 2.5.
It's low.
So you need to watch for toxicity of levothyroxine.
Yeah.
Okay.
Oh, I thought it was the Jackson toxicity.
Excuse me?
The Jackson.
What are you talking about?
Sorry, nothing.
Okay. All right. So side effects. So this is an upper, right? This is giving you thyroid. Okay. So that makes sense that the side effects would be tachycardia, sweating, anxiety, insomnia, weight loss, diarrhea, because it's basically, it can cause you to go into hyperthyroidism. Do you understand? Highlight, levothyroxine is dosed in micrograms. I would say this is one of the most tested on drugs in any pharmacology class.
Oh, yeah.
I don't know why. It just is.
No.
It is dosed in micrograms. And why that is so important to know is because if the doctor accidentally puts milligrams, what's going to happen to your patient?
Oh, you're increasing. That's too
much. They
much.
will be deceased.
Yes.
You're going to cause severe dysrhythmias and the patient will die. So it's very important to make sure that you see it's dosed in micrograms. Okay. Biggest adverse effects. So what happens? I'm getting tons and tons and tons of levothyroxine. So you can go into thyrotoxicosis. And what is that?
Thyroid storm?
Thyroid storm, where everything is so increased. Like take all those side effects times 100. You're going to get such severe tachycardia. You're going to go into dysrhythmias. You're going to sweat to the point where you're getting dehydrated. Your anxiety, you can't sleep at all. You're going to rapidly lose weight and have massive diarrhea. This is a problem, right?
Yes.
Okay. Your heart can go so fast that you go into atrial fibrillation. So your atria is just going bzzz. That's a big deal. Yes?
Yes.
All right. If you have a patient on a chronic high dose of levothyroxine, it can cause bone loss. So if they give you a question, something like your patient was diagnosed with hypothyroidism, they've been on levothyroxine for 7 years. What is a test you'd want to do for this patient?
A bone density?
A bone density scan to make sure that they have not had bone loss. Okay. This is also highly testable. You'll know if something is red, highly testable. If it's in a red cloud, highly, highly testable. Yes?
Yes.
Okay. So there is a different color pill for different dosages. So if your patient calls and they say, hey, I usually get a green pill and this month I got a blue pill, what do you need to do?
I would check with the pharmacy.
Call the pharmacy and be like, did you jack up their dose because she got it? Or check and make sure the doctor didn't change it. Or you need to do something to make sure that they didn't get the wrong dose. You with?
Yep.
Okay. Start low, go slow. We do not want to cause thyroid storm in this patient. So we'll start them at a low dose. We recheck them in like 30 to 60 days, right? And then we'll adjust it. No antacids or lithium. Now, y'all know for pharm, this is an important fun fact for everybody in here. Very, very important. We know we do not take other drugs with antacids.
Yes.
Because it alters the pH in your stomach and that drug will not absorb in your stomach correctly. So that's a given, but this one especially, you shouldn't take other acids, okay? Another fun fact, put this on a red flag sheet. Y'all make sure that you have your red flag sheet. Courtney, pull out a red flag, like get out a sheet and then just put red flags and big things that I tell you, like, hey, you need to know for all of pharmacology, start jotting those things down.
Just like
okay. Either something like that or we can get some, oh, there's none in there. Can you go grab some printer paper from in there? And you can make it fancy and cute so that way you recognize it. But these are big things I'm going to teach you for all of pharmacology. These are things you're going to see over and over again. So it's important for you to note. Okay. All right, pass it around. Take one down and pass it around. 99 bottles of beer on the wall.
You need one?
All right.
You need one, Ashley?
All right. So big red flags for pharm. We do not take any drugs with antacids, right? Because it's going to change your stomach pH and it will not allow you to absorb the medication correctly. You with? Another drug that we do not ever take medication with is called sucralfate. Okay. What this drug is it's for peptic ulcer disease, okay? And it coats the whole inside of the stomach and it hardens. So that way the ulcers are protected. But the thing is, if you take medicine, it's sitting on top of that hardened medicine. It does not get absorbed. So that's another one that you're going to see over and over and over again in pharm. Do not take meds with sucralfate. It's got to be at least 2 hours from you taking sucralfate. With me?
Okay.
Okay.
2 hours?
At least, yes. The other thing that you might see a lot in pharm is we don't usually like people to take meds with iron. That's what Fe is iron, right? Iron it has a huge list of things you can't take it with because it interacts with a million different things. So you'll probably see that again. Okay? Y'all with me?
Yes.
Okay. We also do not want patients taking levothyroxine with lithium. What is lithium?
Is that a psychotic drug?
Hold on, Courtney wants to say something.
Oh no, it's like kind of like an antipsychotic, but like it relaxes you.
Who's it for? What disease do we give lithium to?
Seizures?
Is it schizophrenia?
No. It's not an antipsychotic. It is a psych drug, but it's not an antipsychotic. Bipolar. Okay, so it's a mood stabilizer. What's your keywords for lithium? We've done this 100 times, y'all. 2 keywords for lithium. We did it in cardiac when we were talking about digoxin and potassium. Digoxin and potassium are the same as...
I mean, it attaches to them?
No, they go into toxicity.
Okay, get out your red flag sheet. Y'all are killing me. These things that I keep telling y'all you're going to see over and over again, you got to write them down somewhere because y'all are just missing the boat. We had a huge conversation in cardiac about how digoxin binds to potassium to be excreted, did we not?
Yes.
And I said it's exactly the same as when lithium binds to...
Albumin.
Sodium. Yeah. So your 2 keywords for lithium are salt and kidneys. What are your 2 keywords for lithium?
Salt and kidneys.
Lithium.
Salt and kidneys.
Lithium.
Salt and kidneys.
Everybody. Lithium.
Salt and kidneys.
Thank you. So lithium is a kidney drug. It requires salt to be excreted. Do y'all have any recollection of what I'm talking about? Because we had a whole 30-minute conversation on it. Y'all looking at me like, this is the first time I've ever heard this information. Okay. So anyhow, all right. If the patient is on levothyroxine and warfarin, okay, levothyroxine can interfere with warfarin and we may need to decrease their dose. What is warfarin?
Anticoagulant.
Good. It's an anticoagulant. And I don't want them to go toxic in an anticoagulant because then they'll bleed to death, correct? Yes. Okay. Highlight this. This is always on exams. You are going to tell them to take levothyroxine first thing in the morning on an empty stomach, 30 to 60 minutes before food. Why would you want them to take it first thing in the morning?
Because it tells the body, the organs to wake up.
That's right. It's our get up and go drug, right?
Yes.
So I'm going to take it first thing in the morning, and you can see it interacts with sucralfate, iron, lithium, antacids, warfarin. And then if you look over under MOA, it also interacts with digoxin and insulin.
Yeah.
So, dang, that's why we need to take it first thing in the morning on an empty stomach, nothing else.
What if does it like cause your stomach like, upset? Like,
No.
does it upset your stomach?
Mm-mm.
Okay.
Nope. All right. This is another big testable fact. We're going to tell them do not change brands. Okay. Do not change brands because each form of levothyroxine is made differently depending on who the brand one is. So we'll always write on there, do not change brands or brand name only. Okay. If we have to, because it's an insurance issue, maybe they won't cover it or something, then we need to recheck their TSH. What's the TSH?
The thyroid
stimulating hormone in 30 to 60 days to make sure that level with that drug is okay.
Okay.
All right. Now, in order to make sure they're not going into hyperthyroidism, which very easily could happen because you're giving them a ton of thyroid hormone, we're going to teach the patient to take their heart rate every single day. If they're normally like in the 70s and all of a sudden 1 week they're turning to the 80s and then they go to the 90s, what does that tell you?
They're going into thyroid storm.
They're not thyroid storm because that's still within normal limits, but it's telling me that
it's increasing.
Your dose is too high and we probably need to decrease it because your heart rate's starting to go up. Okay. You're going to watch their TSH every 3 months. And then once we get them into a good level, we only have to check it every year.
Oh, nice.
Okay. We do want them to report excessive weight loss. What is that telling me?
That their thyroid is increasing.
That their medication dose is too high, right? And that they're going into hyperthyroidism. So we need to decrease the dose. Okay. If you look up at the very top of this sheet, it says watch BMs for effectiveness. Get out your red flag sheet. In pharmacology, 98 times out of 100, if they say, how do you know this drug is working? It's something with poop. Okay? How do you know levothyroxine is working? How would you know? They start having regular bowel movements, right? Because in hypothyroidism, what were their bowel movements like?
Slow.
They were constipated, right? And now once they're on levothyroxine, they're starting to have normal bowel movements for the first time in 10 years. So they're like, oh my God, let's rejoice. Okay. So that's a good important thing to note is usually when they ask you, how do you know something's working? Like for instance, let's say the patient has hyperkalemia, right? They have high potassium.
Yeah.
The antidote for hyperkalemia is K-exalate. Okay. And how does K-exalate work?
It goes through the poop.
It makes you poop out your potassium. So how do you know K-exalate's working? They're going to start having 3 to 4 bowel movements per day. Okay. Farm loves poop. You can just write that on your red flag sheet. Farm loves poop. Okay. So it's a lot of poopy stuff. All right. Do we understand levothyroxine?
Yes.
All right. Let's go to our drugs for hyperthyroidism. So what in a patient does hyperthyroidism look like? We'll start at the top of the head. Crazy. So they like ADHD, like do they sleep and they're like talking really fast, like it's, I know it probably sounds like I have this, I don't. Okay. Otherwise I'd be a whole lot skinnier. So they like are like, and they can't finish and then, oh, Ashley's over here and they can't finish, like they're just thinking so quickly. Okay. So move down. Their eyes will like start to bulge out. They get that exophthalmos, right?
Yeah. The heart tachycardia.
Tachycardia.
They increase respiration.
Use your big girl words. Use your big girl words. Y'all. I can't help y'all today.
No, not talking.
High respiratory rate.
Tachypnea.
Thank you, brand new person. Yeah. Okay. Let's go to the gut. What are we gonna see in the gut?
Oh, diarrhea.
They're gonna have diarrhea. What happens to their weight?
They're going to be really skinny.
And they're going to sweat all the time. They're moving and they're vacuuming and then they're fixing things and they're in like a high state. Okay. You can't survive like that, right? There are 2 different drugs that we can use to treat hyperthyroidism and they are almost exactly the same. Okay. All I need to tell you is that they are liver toxic. So what do you need to draw?
AST, ALT, ALK Phos, and bilirubin.
Good. So we're going to draw our liver function test, which is ALT. Say it again. ALT, AST,
ALK
Phos, and bilirubin, and tell the patient to report jaundice. All right. So the first drug is called propylthiouracil. Nobody got time to say that, so we call it PTU. Okay, literally nobody can say that. Try.
I can't.
I know. It's like so embarrassing when you try to say it because everyone's like propylthiouracil. Okay. So PTU. Now the downside for PTU is it is TID dosing, which is
3
times a day. Nobody got time for that. Nobody even takes their pills 1 time a day, right? Okay. It takes 6 to 12 months for this drug to normalize. What a piece of crap.
That's a long
They're
time.
like, here, take this drug 3 times a day, and in 6 months, you're going to be feeling good as new. I'd be like, screw you, thank you. All right, the drug class is called a thionamide. It is liver toxic. Okay, so Courtney, I think I told you this before, but whenever you see me draw an organ, it's because it's toxic to that organ. Okay, so that way your body starts and your mind starts to associate those. All right, y'all are going to want to tune me out when I tell you the MOA, but please bear with me, okay? It's easier than it sounds. Do y'all need a minute?
No.
Oh, okay. All right, so MOA number 1, it inhibits thyroperoxidase. If something ends in ACE, what does that mean?
That is an enzyme.
It's an enzyme, and what is an enzyme's job?
To eat.
Yes, it's going to break something down. So this is the enzyme, the thyroperoxidase is the enzyme that oxidizes iodide to iodine. Y'all know iodine is very important for thyroid health, right?
Yes.
All right, so that binds with something called tyrosine. Tyrosine then goes into thyroglobulin, and thyroglobulin makes T4. What have you learned about T4?
That you need T3.
Well, T4 turns into T3, and that's active thyroid, right?
Yes.
So if this inhibits that enzyme, then you're never going to make T4.
Okay.
Right? It inhibits the enzyme that starts that whole process. So you're not going to make any T4, and that's what I want to do because I need to lower this, right? Yes. MOA number 2, it inhibits the enzyme that converts T4 into active T3. So they're like, hey, if any T4 like squeaks through, it's going to squash it, and it's not going to let it convert to active. Do we understand?
Yes.
Okay. You can use it in pregnancy, but I'd prefer you not to. Okay? If you have to choose between PTU and the one we're about to go over called methimazole, you would choose PTU.
Okay.
Okay? All right, so side effects. All our liver patients itch. What'd I say?
All our liver patients itch.
All of them. They all have itching. And what's the name for itching?
Pruritus.
Pruritus. So that's why you're going to see rash there because it's liver toxic, so it's going to cause a rash. Okay. Hair loss is common because it is it's decreasing basically the thyroid again, and so you're kind of going into hypothyroid. We don't want that to happen, but that can happen. It may cause your skin to have increased pigmentation. So what? You're not going to die. Your liver is in which body system?
It's in your right upper.
Which body system is it in? Like your pancreas is endocrine. Your liver is.
Oh, hepatic?
GI, good. All right. So since it's in the GI system, okay, we're going to see GI side effects like nausea, vomiting, heartburn. Y'all with me?
Yes.
It can cause you to go into hypothyroidism because it's slowing everything down so much, okay? And they may just feel a little kind of achy because what are arthralgias?
It's a pain.
So arth means? Joint. Algia?
Means pain.
That means like muscle aches, right? So arthralgias is pain in the joints, okay? And then you see paresthesias. What are paresthesias?
The numbness and tingling.
Numbness and tingling of the extremities. All right. Why would they have paresthesias with this drug?
Because if everything is slowing down.
What kind of problem is paresthesias?
It's a nerve problem. Oh, because their brain is like so. Oh.
Y'all know the answer, so I ain't giving it to you. Okay. It's on your page. I didn't write exactly, but you should be able to put it together. It's a nerve problem. What makes healthy nerves?
The liver.
What part of the liver? Or what does the liver do that helps to make healthy nerves?
Vitamin B.
B vitamins. So the liver makes B vitamins. What's the job of B vitamins?
Healthy red blood cells.
Healthy red blood cells and healthy nerves. So if it's liver toxic, it can't make your B vitamins, so you're going to get paresthesias.
Okay.
I don't know what happened to y'all. Okay. Adverse effect. This is one of the most testable things in all of pharm. PTU causes agranulocytosis. What are granulocytes?
They're your white blood cells.
All right. And A means? Without. So it's going to cause low white blood cells. Okay. That's going to put your patient at risk of infection. So anytime in pharm, this needs to go on your red flag sheet. Anytime in pharmacology where one of the side effects of the drug is agranulocytosis, the answer will always be report sore throat and fever. I don't know why they just pick sore throat and fever. Every school in the history of all time has done this. And there are a lot of drugs that cause agranulocytosis.
Yeah.
Okay? So if you ever see agranulocytosis, first of all, it's very testable. Second of all, report
sore throat and fever.
All right. And why might this patient on PTU have agranulocytosis?
Because the liver makes blood.
The liver helps to make white blood cells.
White blood.
So if it's liver toxic, you may have a decrease in your white blood cells. All right, what is aplastic anemia?
Anemia is low white blood
Oh my dear God. Help us, Lord. Dear sweet baby Jesus.
Since they have like low white blood cells, well, anemia is like your blood, like you're just a deficiency
of what?
An iron?
And
Iron.
Y'all,
no, they do have iron.
What is anemia? That's a very simple question.
It's low blood. Low levels of your blood.
Ma'am, low levels of your blood.
Ashley, you want to chime in?
What?
What is anemia? Oh, fucking A.
Y'all said loss of blood.
They said loss of blood. Y'all, that's trauma.
Like,
that's a gunshot wound.
Is it like lower red blood cells?
Thank you, Ashley. I appreciate you being here today. What is anemia?
Low red blood cells.
You don't have enough red blood cells. Y'all are way too advanced in this nursing program to be pulling this shit today. I don't know how to help you. Aplastic anemia is when all the cell lines are low. So aplastic anemia is the same as pancytopenia. Okay, what does pan mean? Forget it. What does cyto mean?
Cell.
What does emia mean?
Blood.
Okay. What is a panoramic photo?
Oh, like a very wide.
All the way around. So what does pan mean? All. What does pan mean? All. What does pan mean? All. What does cyto mean? Cell. What does emia mean?
Blood.
So all the cells of the blood are low, meaning you have low white blood cells, low red blood cells, low platelets. Now, why would a patient on PTU have aplastic anemia?
Because the body makes, or the liver makes,
Because the liver's in
white blood cells.
The liver makes white blood cells, red blood cells, and platelets. So if this is a liver toxic drug, then they're not going to be able to make those. They can go into full out liver failure. So PTU don't play, does it?
No.
Okay. Why am I reporting sore throat and fever with PTU?
Because of the agranulocytosis.
Agranulocytosis. Why am I checking LFTs, liver function
that's
tests?
Liver tests.
Okay, now y'all going like you geniuses. All right, why am I watching a CBC?
Because you're going to be checking their white blood cells.
White blood cells, red blood cells, and platelets are all in the CBC.
Yes.
Why am I doing good hand washing?
Because of infection.
That didn't tell me nothing.
Agranulocytosis.
Agranulocytosis. Why are we doing bleeding precautions?
Because if they are not producing the blood cells, then they're
Which blood cells?
They're platelets.
They're platelets. So it could be with aplastic anemia. If their platelets are low, then we would need to put them on bleeding precautions, right?
Yes.
Why would I tell this patient to report jaundice?
Because of the bilirubin.
So PTU is liver toxic. Yes?
Yes.
All right. Why am I going to teach them medication compliance?
So they take their medication properly, so then they don't have.
You're giving me
these
super
problems.
generic answers that don't tell me anything. Why specifically on PTU?
Because you don't want them to go into.
No, I told y'all something about PTU that would be very important for you to look at medication compliance and make sure they're taking it. How many times a day do you have to take this drug?
3 times a day.
3 times a day. So that's why medication compliance is important to discuss with a patient. You have to tell them, hey, I know it's a pain to take it 3 times a day, but you need to make sure you take it or it's not going to work correctly. Okay? Do not breastfeed if you're on PTU. Okay? It does go through the breast milk, and we don't want baby getting all hyperthyroid.
Yeah.
That baby be like acting like they on crack.
Okay, because if the baby has, if the mom has hypothyroidism, then the baby has hypothyroidism. If the mom
It's
has
not the opposite.
The baby doesn't get it?
Nope.
That's weird.
It is.
Okay.
Because for whatever reason, the hypothyroidism is congenital, but hyperthyroidism is not.
Oh,
okay. All right. So are we clear on PTU?
Yes, ma'am.
Now, methimazole is almost exactly the same. So I'm hoping you listened to the words that came out of my mouth, and now y'all are able to teach me back.
Yes.
All right. Methimazole. Now, this is important to write on your red flag sheet. Your azoles, AZOLE,
are liver toxic.
are antifungals. But hold on. This is not an antifungal. So if there's an azole, that's an exception to the rule. I will always tell you. And this is an exception to the rule. Is this an antifungal?
No.
No, because that wouldn't make sense to give a hyperthyroid. Well, how's that going to help her? Okay. It's not. Okay.
Yeah.
So methimazole is an exception to the azole rule. Okay. It is once a day dosing, which is nice. Okay. It is still a thionamide. It is liver toxic. The MOA works almost exactly the same. Okay. You cannot breastfeed, just like PTU, but you also can't use it in pregnancy.
Oh, okay.
Okay. And look at the side effects. Tell me if this sounds familiar. Rash, hair loss, skin pigmentation, nausea, vomiting, heartburn, hypothyroidism, arthralgias, and paresthesias.
It's the same.
It's exactly the same. So if you know PTU, you will know methimazole.
Methimazole.
Agranulocytosis. What do you report?
Sore
Throat and fever. Instead of aplastic anemia, it just causes thrombocytopenia.
Thrombocytopenia.
What does thrombo mean?
Platelet.
Like a clot.
A clot. Cyto?
Cell.
Penia.
Small.
Low.
Low.
So your clotting cells are low. What are your clotting cells?
Your platelets.
Your platelets. Okay. And then instead of liver failure, it just causes no big deal, just hepatitis. What is hepatitis?
Your liver's inflamed.
Your liver's inflamed. Okay. So again, we're going to report sore throat and fever, check our LFTs, monitor CBC, bleeding precautions, report jaundice. Does that all sound familiar?
Yes, ma'am.
Easy enough.